My name is Lila Blaylock. I am a second-year medical student at UCSF, and I'm really excited to introduce the next part of our symposium. The next hour will be dedicated to discussing air pollution and wildfires, and we are really excited to have some expert leaders and advocates on this panel to engage with this aspect of climate change. Just for some background, air pollution is one of the greatest environmental determinants of early morbidity, causing 7 million premature deaths each year from respiratory conditions, cardiovascular diseases, neurologic disorders, and diabetes. It is estimated that over 90% of the global population is exposed to airborne particulate matter at levels harmful to human health. These health harms are disproportionately experienced by communities of color, particularly Black, Brown, Indigenous, Asian, Pacific Islander, and low-income communities, and decades of environmental injustice demand visibility and advocacy. Wildfires in California have become a visible manifestation of the climate emergency, getting hotter, faster, and more uncontrollable each year. The outcomes of these fires include immediate loss and injury, long-term respiratory, cardiovascular, and oncologic health harms, and increasingly prevalent PTSD and climate anxiety. Health professionals have an important role to play in supporting and amplifying community-led efforts for protecting populations, particularly communities of color and low-income communities. They also have an important role in uplifting their patients by responding to their concerns with supportive resources and recommendations on how to protect their health. If you have any questions for our panelists or just about this, our section in general, feel free to post your questions in the Q&A Zoom or the Q&A box in Zoom. And then now I'm really excited to introduce some wonderful panelists. I wish I had the time to share all the amazing accomplishments and backgrounds of these speakers, but I also want to make sure we have enough time to hear their expertise during the panel. So I'll just be sharing a few words about our upcoming panelists, and then we'll post their longer bios in the chat. First is Nayamin Martinez, the Executive Director of the Central California Environmental Justice Network. Nayamin has vast experience in working with immigrant and indigenous communities across the San Joaquin Valley, managing public health programs in a variety of environmental topics, including pesticides and air pollution. Thank you so much for being here. I'm really excited to hear what you have to say.
Thank you for the invitation. It's a pleasure for me to be here and just to share what we have seen in frontline communities that are heavily affected by pesticides, by wildfires, by drought, by heat waves, and a lot of many more impacts of climate change. Today, we're going to focus on wildfires, but definitely that's just one of the many impacts of climate change that we've seen, not in the decades to come, but now. So thank you for the opportunity. Are the slides going to be projected, or I should pop up the slides?
Do you have your slides with you? And if you do and are able to present them, that would probably be best so you can have control.
Okay, bear with me. Well, so as I was mentioning, my presentation is going to focus on just one of the several climate change impacts that I mentioned, and that is wildfires. And wildfires in particular, with what it relates to the most that are affected by this phenomenon. Obviously, every person living in California, and for that matter, in the western states of the US, where we have experienced significant wildfires in the last 3-4 years, but I will explain why farm workers are more vulnerable than other populations. But before I go deep into the topic at hand, I would like to take a minute to introduce the organization that I have the privilege to direct and to represent at this symposium. I am the executive director for the Central California Environmental Justice Network. I know it's a mouthful, so a lot of people just know us as CCJN. And we were founded in 2000, so 22 years ago. And since then, I am very proud that our founding members were visionaries that even before environmental justice was a topic that was popular and that now every agency wants to use, even before then, our founding members already knew that we needed to do something to stop the environmental racism and to achieve economic justice and health equity in our region. And we're doing that by empowering our communities so that we can have a better future for ourselves, but most important for our children. Because the matter of the fact is that not everybody is affected equally by the significant pollution burdens that we face in the Central Valley. People of color like me, low-income people are more affected than anybody else, and among them, the farm workers. And why the farm workers? Because while you, me, and most people that do not have an outdoor job, we have the privilege of sheltering in our places when COVID happened for COVID, or when wildfire happens for wildfires, to be protected from that smoke that we know is dangerous and that we know that put our health at risk. But what happens when your job requires you to be outdoors for 8 or oftentimes 10 hours a day? That means that you are more vulnerable to that wildfire, to those wildfires. And that's the case of farm workers. And yes, I know they're not alone. Construction workers, landscapers, and pretty much any occupation that requires you to be outdoors are equally impacted. But my presentation is focused more on farm workers because they are the most constituents that we work with, because agriculture in the Central Valley is one of the primary industries. Therefore, a large percentage of our population in the valley, that's their occupation. They're farm workers. And then there are other issues in terms of access to healthcare. For example, a lot of them are uninsured, that make them more vulnerable to this type of phenomena like the wildfires. Gladly, California is known to be a state that is trying to pass laws and regulations to overcome the multiple effects of climate change. And that continues to happen. Just this month, the governor has signed several bills that are going to help us gain some improvements. And one of them was a law and something that led into the establishment of a regulation in July of 2019, which is the protection from wildfire smoke. I want to say that this regulation does not only apply to farm workers, it applies to all outside workers. What it consists of is that it provides things that the employers need to be doing to protect the outdoor workers. So what are those things? First and foremost, they need to monitor when the air quality is dangerous. They need to provide training to the workers and also protections to different actions that I will describe in a minute. So let's start with monitoring the air quality. We know that right now it's like almost impossible to understand all the different network of monitors that are available. Air districts have their own monitors, CARB have their own monitors. But to make it simple, one of the recommendations of this rule is that the employers could use websites such as the Air Now, which is probably one of the most popular ones, but also some of the local air pollution control district websites. And the key is that they need to understand what is the air quality index, or AQI. You see here in the screen, it goes from 0 when the air quality is green, it's good, all the way to 500 when it's hazardous. Well, the regulation establishes that when the air quality, or AQI, it's at 151 or more, that's when all these measures that I will describe triggers. That's when they will need to start doing changes. So therefore, the idea is that they have to be monitoring their air quality throughout the day, because it doesn't mean that if the air quality was fine in the morning when they start working, it's going to stay like that for the remaining of the shift. So in addition to monitoring the air quality, employers need to provide training to the workers. A key aspect that I want to highlight here is that the training has to be in a language and in a manner that is understandable by employees. And that is key because if you just give an individual a brochure in English or a brochure that is so technical that nobody's going to understand, then it's meaningless. So I have here an example of some of the materials that have been developed by universities that really allow employees just to use this so that they don't have to recreate the wheel. So some of the things that are included in these materials are, most importantly, what are the health effects of wildfires? This is so important, especially for farm workers or other populations that have low education and that have the pressure, the economic pressure of feeling that they need to work despite if their quality is bad. Why? Because if they don't work, they go home, and then that means that they have less income for that week, for that month, and that put a lot of more economic pressure in their families in making enough money to support their needs. So that is why it is so important that farm workers and other workers understand what are the health effects of wildfires. The second thing that needs to be included is that they would know how to use properly a respirator or an N95 mask. A free mask must be provided by the employer. And then there has to be some accommodations done in the workplace. For example, some engineer controls. What does that mean? If they have like a big indoor space where they could put workers for some time, allowing them to go back to their vehicles or any enclosed location where they could be shielded from the smoke. Another task is the administrative control, which means relocating workers to another location, changing work schedules, providing more breaks. And as I said, providing the N95 mask. So those are the things that the rule says that needs to be done. And this information should be provided by the employer to the employee. We were wondering, was this happening? Are farm workers really knowing about this law? Are they receiving the N95 mask? Because in the middle of COVID, in 2020, my organization had the opportunity to provide financial assistance to farm workers, especially those who were undocumented that did not qualify for any type of financial assistance from the federal government in particular. And we were noticing that they did not, that's when we were having wildfires. We had the creek fire that year in the Central Valley that lasted for months. And well, in the middle of that, we were asking, do you know that you need to be using this mask? Have they given the mask to you? And a lot of people were saying no, no, no. And that prompted for us to create a program in 2021 that included the implementation of 307 surveys between June and July. In order to thank people for their time. It was a very short survey. We gave them a $10 gift card. And these are some of the results. One question was, how do you know if there is bad air quality? As you could see here, almost 30%, they just say visually. They look at the sky, they see, oh, is it hazy? Is it dark? Can I see the smoke? Followed by watching the news as the second most common way in which they find out if the air quality is bad. And almost 20% also say if they experience physical symptoms. Some of the people we talked to, they were saying they had like burning sensation in their chest, or they felt their chest like oppressed, or some difficulty breathing. But as you could see, in reality, there's really a lot of people really don't know what other resources are there. Just only 2% know how to check a monitoring platform, and only 11% say they know how to check in their phones using the weather app or other apps. Just to, if you're not familiar working with farm workers, a lot of them are monolingual, still in Spanish. A lot of them do not have these fancy smartphones. Therefore, having an app or those kind of things are not as easily accessible as someone other or other people can think. Then we also ask, how do people protect themselves from bad air quality while working in the fields? And that was very concerning to us, because as you could see here, most people still rely in the element that they use for whatever, which is regardless if it's there are wildfires, you go to a field, and the most common thing that you see is farm workers using a handkerchief to cover their faces to protect from dust, pretty much. But they feel that that's enough. If it protects them from the dust, it should be enough to protect them from the smoke. And we all know, especially U.S. physicians, that that's not the case. And that was why it was very concerning for us that was the main. Over 56% of the participants that were surveyed said that was the main thing. 20, almost 21% say that they wear a disposable mask, some of those surgical masks. But again, those are not as effective, and a very, very minimal, less than 10% are really wearing the N95 mask, which is the designated PPE that should be used to protect from wildfire smoke. Then the other key thing was, do they know about this regulation? Had the employers been abiding by the regulation? And what we said is that we were surprised, frankly, that more than 50% said that yes, they knew that the employer should be providing them with a mask, but still 44% said they did not know. However, the more interesting part is, were they giving them the mask? As you could see, close to 50%, 41% said no. So one thing is to say, hey, I should give you the mask or use the mask, but they were not giving them the mask, which create really a significant burden for farm workers, even when they knew that was the mask they needed to use. Why? Because at some point, especially in the peak of the pandemic, N95 masks were very difficult to get and very expensive. Just to give you an idea, even a surgical mask, if you go to one of the little towns that are located in rural communities here in the Valley, I did that in the community of Terravela, and I stopped to grab some water, and I noticed that they were selling the surgical mask for $1 a piece. So can you imagine how much an N95 mask would cost if you can get your hands around one? So definitely a lot of people or employers were not providing it. If you combine the no's with the don't knows and others, that's more than the 50%. So just less than 40% of the employers were fulfilling the obligation of providing the N95 masks. As far as how would the participants would like to receive the information, most people said that they want to receive the information through a text message. Why? Because of what I mentioned before, that a lot of them only have one of those cheap cellular cell phones that do not have apps or any other way of getting another type of communication. So text message is by far the preferred method, followed by TV and radio, which aligns well also with the most common methods that are used to inform Latino, Spanish speakers about any type of information, and in this case, about the wildfires. So in general, what we draw as conclusions from this survey that we created is that there has to be more improved access to PPE, meaning that a lot of more masks should be distributed, that the farm workers and other workers should not be depending on the kindness or the honesty of their employers, and that the state or other agencies should be distributing this widely. There should be a campaign and a way also of having this broad text message system where everybody is aware of the air quality, especially when there are wildfires. And unfortunately, last year we worked with Assembly Member Robert Rivas, who introduced a bill that would have created that text alert, and not only for farm workers, but for every Californian. That bill didn't go through. I think we think it is vital that this information is available, so we will try to work again with Mr. Rivas or any other either senator or assembly member that would consider supporting this type of measure being adopted. And then the most important thing is really that they need to modify the chips, or they need to make them shorter. They need to find employers that do not follow the rules. And frankly, if you ask me, I think that of what we heard, and this was just anecdotal information that we did not capture because that was not a question that we included in the survey. But we have been distributing masks ourselves, and some of the things that farm workers tell us is that, well, thank you for the mask, but frankly, I'm not going to wear it even if there's a wildfire. And when I ask why, well, the reason is they feel that they can asphyxiate or they cannot breathe, because most of the wildfires that we have experienced, at least in the Central Valley, happen during the summer months. And what we have is extreme heat in addition to the wildfires. So imagine wearing an N95 mask, and I know a lot of you doctors wear them in the hospital all the time, so you know what I'm talking about. But imagine not being inside an AC building. Imagine being in the field at 100+ degrees wearing that mask and doing physical work. So, for me, the solution is not only to give them the mask or even shorten their shifts. I would add that they should be creating a program that would allow farm workers and other workers to take the day off that day when there is a really bad air quality, but without fearing the loss of income. So creating some sort of hazardous pay of sorts that could allow them to do that. And that's the end of my presentation. So I am happy to answer any question that you might have, or wait for other presentations or panelists.
Thank you so much, Naomi. That was a really wonderful presentation. We do have questions for you, but we're just going to wait until the second panelist goes. And we have Connie Cho here with us today, who is going to be our second speaker. Connie Cho is an associate attorney at Communities for a Better Environment and a member of the AB 32 Environmental Justice Advisory Committee for the 2022 update to the Climate Change Scoping Plan at the California Air Resources Board. So whenever you're ready, Connie, please feel free to start the presentation, and then we will have more discussion afterwards.
Fantastic. I hope everyone can hear me. If you'll give me some kind of sign, you can, while I put this into presentation mode. Perfect. Hi, everyone. Good morning or afternoon. I'm so sorry. Naomi, it's so hard to follow your incredible work and the really deep organizing that you all do. And I'm going to try to make this as interesting as possible because we're zooming out to, the 50,000-foot level to talk about our state's climate change scoping plan. I'm an attorney with Communities for a Better Environment, and you have my bio in the chat there. And what I wanted to share about CBE is that we organize primarily in fence-line communities in 4 neighborhoods, Richmond and Wilmington, which is where the largest concentrations of oil refineries are on the West Coast, and also oil extraction sites. And East Oakland and Southeast LA, which are, of course, massively zoned for industrial facilities and between highways, so diesel transit corridors related to the ports that are nearby. And I think this is a group of folks who are very interested in this subject and passionate about health justice and climate justice. So but for those who are not familiar, the Cal Enviro screen, provides a really really traces the legacy of environmental racism in our country to show that, the worst outcomes for health are related to the sites that have been redlined. And because I'm a lawyer, you have a lot of text there, but California's greenhouse gas reduction laws the current structure currently come from legislation passed in 2006 that tracks how much greenhouse gases the entire state emits by sector, and to plan to have reductions by 2030 to reach at least 40% below the 1990 levels of greenhouse gas emissions. And then there are several executive orders that look at and also recent legislation looking at attempts to codify a carbon neutrality standard. And carbon neutrality is a frame that environmental justice communities don't necessarily adopt. And each community is different, but it's important to note that carbon neutrality really refers to simply accounting for greenhouse gases and doesn't account for the pollutants that are also emitted by these sources of carbon emissions as well. So you can understand why that is the case. And there's other legislation too that says that the state has to ensure that its policies do not disproportionately impact low-income communities and also prioritize direct emission reductions, meaning actually just reducing the amount that is emitted into the air to begin with. And I have the pleasure of serving on the Environmental Justice Advisory Committee with Martha Dina, Aguayo, and this year the climate change scoping plan, which is a 5-year blueprint for the state's climate policies to ensure that we reach these reduction targets, has an environmental justice advisory committee. And this year is we developed 20 pages of draft recommendations. We had our first tribal representative, which is really unfortunate that, and they were brought in quite late, unfortunate that no, state no climate change advisory process has included that this kind of tribal representation before, but we have Jill now. And what's interesting about the climate change scoping plan is that there's also, before I go on, a few different stages that happen. And you would think that coming from a community perspective and thinking about the health outcomes, or if we were thinking about health outcomes and truly prioritizing community health, we would start from the place of, well, where can we get the greatest advancements in health outcomes? And we would center the experiences of community members, and we would also be able to meet all of those other statutory obligations. Instead, the way that the scoping plan process works is to essentially look at technologies and the cost effectiveness of those different technologies, and to look at all sectors from a really macro GHG emission perspective. And this is one of the first times that we really dug into the details of that process. And I only share that just to say that it's just like the first research question, or where you start in the planning process, really matters. The process itself has not been designed to produce an equitable outcome. So it's really important to have advocates involved in the process, including stakeholders and people who have unique experiences to offer, like yourselves as medical professionals. So in our draft recommendations, we asked for a really aggressive, transportation targets, for clean transportation and for massified transit, for plan to phase out oil refining and extraction with end dates, to have no new gas plants, to phase out gas plants, and to have a zero greenhouse gas emission target by 2035. And to make sure that we weren't going to be funding any climate policy dead ends, to allow polluters to keep polluting. And I can talk about those dead ends a little bit moving forward. And so we've had a draft scoping plan released, and there was, the number of comment periods, and we've had a number of board hearings. And as a result of those hearings and advocacy from some of the very doctors that are part of this, the PSRLA community, the second draft of the 2022 scoping plan is up and coming sometime later this fall before there's a final vote in December. And what's very interesting is that it wasn't just environmental justice advocates and communities that were outraged with the draft scoping plan that came out. Current California climate change policy relies really heavily on the cap and trade program. And without going into a lot of details, essentially, there are a number of different climate strategies, and the most effective ones to meet these greenhouse gas reduction targets have really been coming from the electricity sector. And that's because there's a direct emission control mechanism that says we want this much wind, we want this much solar, and we need to reduce the amount of fossil fuels that come online. And so, mainstream media outlets have been calling, called the state out on this. And a huge coalition of environmental justice groups also came together to talk about how we needed a detailed, realistic plan because there were only 6 pages around cap and trade to actually meet our 2030 target goals, and also to maximize these direct emission strategies before turning to other alternatives like carbon removal, whether including mechanical carbon removal, which you may have heard of as giant fans that suck carbon out of the atmosphere to get rid of the past emissions that we continue to emit emissions, but past emissions as well. And that we actually need to plan for these direct emission reductions. Another large coalition of organizations criticize this plan, including Naeem's organization, to maximize near-term solutions, right? Not to punt the climate change actions that we need to take to 2030 or 2045, but to make sure that we're starting to phase out fossil fuels now, and to invest in renewables now, and to invest in natural working land strategies to have natural carbon removal now. And of course, massive investments in order to make these accelerated targets equitable for all communities. Because we know that it's challenging to simply get rid of your old diesel truck if you don't have the funds to actually buy a new electric truck, right? So the state climate plan is really a blueprint, but it has really broad signals that it puts out to industry and also directs the next steps and rulemakings that the agencies are all going to take to meet these targets. And I'll close out here with a call to action. The governor and California Air Resources Board, we want to hear from you, and we really need support in asking for opposition to carbon capture, utilization and sequestration technology to be used that is planned to be used on fossil fuel and bioenergy infrastructure. If I can talk about this for a second, one of the things that's happening is that new technologies like carbon capture have come up, and carbon removal technologies as really shiny, fanciful technologies that offer a solution that the fossil fuel industry has been pushing at the federal level. If you saw some of the news that came out of the IRA passage, but also it really allows the fossil fuel industry and bioenergy sources to continue to emit while despite a poor record and the fact that they're incredibly energy intensive to operate, and without accounting for the cumulative pollution that persists and may be added because of this carbon capture technology. And there have been a few permits that have been applied for, and groups in the Valley have been really active in fighting off and asking that there be real due diligence done before these facilities are sited in their communities. But we have a chance in the scoping plan to provide some finer detail and say, here are some places that are off limits. The communities that live next to fossil fuel infrastructure and old zombie biomass plants don't need this additional pollution. And this is not where you should test out this technology. We are not your guinea pigs. So, and instead, there are other strategies. What's interesting is that the IPCC report really talks about these technologies in any case as a last resort to do at the end after prioritizing direct emission reduction strategies. And we have yet to see, there's still greenhouse gas emissions being left on the table. And so any effort to prioritize these direct emission strategies would be most welcome. Happy to take any other questions or open it up for discussion.
Thank you so much for that wonderful talk, Ani. Let me transition over to our panel discussion portion of the talk. Everyone, my name is Dr. Obonio. I'm a neuroscientist, medical student, and organizer based in San Francisco. And I have the great privilege of introducing Dr. David Cook, who will join our panel discussion. Dr. David Cook is associate professor at the UC Davis School of Medicine. He is the chief of the Division of General Thoracic Surgery and the director of the General Thoracic Surgery Robotics Program. Dr. Cook currently serves on the American Lung Association National Lung Cancer Expert Medical Advisory Panel. Dr. Cook is the co-founder of LCSM Chat, a patient-centered social media Twitter chat and patient engagement network that has had over 50,000 participants and 60,000 tweets and 2 billion impressions since its inception in 2013. First, I'd like to direct a couple questions to Naomi on her talk. We're hoping you can share with our audience some of the solutions and success stories of climate justice within California and how those examples could be followed and amplified.
Sure, thank you. Great question to receive after last week. There's not a lot of moments in which sadly we can celebrate victories for our EJ movement, but that was not the case last week. On September 16, Governor Newsom signed a bill that would establish a safety setback of 3,200 feet between sensible locations, meaning homes, schools, clinics, any place where people gather, and oil sites. Why? Because a robust body of research has documented how dangerous it is to live within that distance of an oil site. Because of all the fugitive emissions that are coming there, a lot of them are still, emitting VOCs. Many of them are VTECs that we know can cause cancer. So there has been already proven that it's not safe, and because of that, this bill will establish that setback. It took many years of fighting, and it was a moment of happiness for a lot of us as EJ activists and people who live in that communities where Connie works down in LA, all the way to the Central Valley and other parts, Richmond, and other parts where there are refineries and oil rigs, etc. So that was a major victory and definitely an example of it is important to act and to try to become champions on climate change, but we cannot do that just in rhetoric. We need to start by doing and what we need to do to make sure that we're prioritizing public health over anything else. Because if we're just going to talk about, oh, we need to reduce our carbon emissions, we need to reach carbon neutrality. Yes, but we are going to cause other harm, especially for frontline communities. That's where we need to stop and put the brakes. And that's what Connie was referring to when sadly, we got a mixed bag in some of the bills that Governor Newsom signed last Friday. For us, the victory of the setback bill was a major cause for celebration, but we are concerned because among those bills that were also approved was in SB 905 that would allow the state to start exploring and even investing in carbon capture sequestration technologies, which have not been proven to be safe for our communities and could create more harm, especially for frontline communities. And as Connie said, we're not guinea pigs. If they are trying to reduce carbon, by testing these technologies at the expense of the harm that will create to frontline communities, then we shouldn't be doing it. And the opposite of that is the bill that I just mentioned, that we're happy that it was approved, it was passed. However, I have to say that the other part that is not so good, though, the oil industry is not, sitting down and taking in or patiently waiting for this victory to happen and for their oil wells to go away. Last Monday, on the 19th, set of attorneys, we do not know which companies they represent, but certainly they represent large oil interests. They have filed with the state attorney. They have requested the title and a summary because they're going to be trying to do a referendum to repeal the bill that was just approved. So that's all the work that oil industry is going to try to do to stay alive at the expense of the health of 4 million Californians who have been protected because they live within that 3,200 feet setback. And Connie, I don't know, you want to add, I know this was a major fight for all of us.
That was perfect.
Thank you so much, Naimeen. We have extensive experience working with frontline communities from immigrant and indigenous background. I'm wondering if you can speak to, with equity being a central theme of our symposium, if you can speak to how you best transcend language barriers and navigate cultural and linguistic biases to maintain a sustainable and cohesive front in terms of finding climate solutions.
Wow, a very charged question. Well, language is basic, right? And sadly, although even to go to the doctor and get care, supposedly you have language access, right? That you are entitled to get an interpreter if you don't speak the language. That again is the theory. In practice, I have worked with immigrants that not only come from Mexico, where there's already still over 60 indigenous languages spoken, and at least 30 of them we have mapped in California. But now with all these more recent migration, there has been an influx of Central Americans with a whole new set of languages that I was not even aware of. So because of that continues to be the challenge when they go to the doctor, but even when they are working, if the employer is not going to provide the information that I mentioned that they are entitled to receive to be protected from wildfires in a language that is appropriate, that they could understand, then it's going to be meaningless. And I understand the challenge is that a lot of indigenous languages do not have a written version. However, oral translation should be, used and make sure that the right information that would allow someone to protect their health, either at a workplace or when they go to the doctor, is there. That should be like, the bottom line.
Thank you so much. I'd love to bring Dr. Cook's voice into this conversation. Dr. Cook, as a clinician, what effects of air pollution due to wildfires have you seen in the clinic? And how do you currently leverage your patient experience through advocacy? And how would you best recommend other physicians and health professional students get involved?
Well, thank you very much, Odd. And I really want to appreciate Naomi and Connie on their presentations, which are both educational and inspiring at the same time. I think those are a lot of different questions that can have a lot of different answers. One thing that really stood out for me from Naomi's survey was when she surveyed community members and asked them, how do you know when the air is bad? And the majority of the respondents said, well, we look at the sky and see, how cloudy it is. And what we do know, what we do definitely know from air pollution and what we're understanding from wildfire smoke, that the small particle particulate matter 2.5 is what causes the lung injury that is a carcinogen and can lead to lung cancer. The World Health Organization defined that way back in 2013. And we have more and more evidence to show that PM 2.5 is one of the culprits that can lead to lung cancer. However, that's invisible. You can't see it in the sky. That dark cloud that we're seeing is other byproducts of wildfire and pollution that are dangerous, but completely unrelated to PM 2.5. And so that level of understanding from our communities, and then going back and taking that information and educating our community members, and as physicians at the point of care, and educating our patients. The other thing is the air quality index. We do know that 100 and more is worrisome for people at risk, and that includes our family members and friends with asthma and COPD, and 150 is unhealthy. But that's a single day measurement. What about the accumulation over time, over many days? 50 has particulate matter in the air when the air quality index is only 50. So those questions we don't know, but we are concerned that an accumulation over time will have long-term negative impacts on our lung health. And so these are just a few things that we have to consider when we talk to our patients and talk to our families and friends.
Thanks so much for that comprehensive answer, Dr. Cook. In 2015, you co-founded the LCSM chat, and I was wondering if you could speak a little bit to your experience of starting that social media channel and your perspectives on how social media platforms can be used effectively to advocate for improving air quality and other determinants of lung health.
Sure. So for better or for worse, a lot of people get their information from social media channels. Now, whether that's Twitter, whether that's Facebook, whether that's TikTok, a lot of people are using TikTok videos. And social media can be an instrument of misinformation, but social media can be, in the proper settings, a vehicle for curated, properly vetted education and information. And with lung cancer social media, that was a multi-stakeholder founded group, including family members of people who had lung cancer, physicians, researchers, and survivors themselves, really putting out there key information that can help us and our families find the proper care and treatment for the #1 cancer killer in the world, which is lung cancer. And I think it's a wonderful opportunity to spread information about causes of lung cancer that are not tobacco related. And in this case, specifically poor air quality and air pollution. And understanding that this is a risk factor for developing lung cancer, and it's a correctable risk factor. It's something that Naomi and Connie are working on right now, and others, to create legislation and create policy that will improve our air.
So much for that. And this last question in our last 5 remaining minutes together relates to advocacy, and I'd like to present it to all of our panelists. We can start with Dr. Cook. You serve on the American Lung Association's medical advisory panel. So you can speak to your experience advocating on a national platform and share with our audience, and specifically students, how to best leverage advocacy efforts during their careers.
So at UC Davis, we really encourage our learners and trainees to know more, to learn about policy, our relationship and proximity to Sacramento makes that easy. But just as we've heard some key experts in the area of climate change, climate health, I think physicians at the front line understand what's at risk the best. We see our patients suffer. We work to restore their health, and we see the relationship between poor air quality and our patients' outcomes. So we are in a wonderful position to help individuals like Naomi and Connie to affect change, affect policy, because we understand what's going on a medical level and on a scientific level, and really on a human level as we relate to our patients and their families.
To Connie and Naomi, how can health professionals best leverage their voices and positionalities to support organizations like yours and best advocate within their own institutions?
Well, I would say that it really helps, and I'll give an example. Sometimes it's just like a phone call, a brief testimony at some of the CARB hearings, at some of the Air District meetings, or when we're trying to pass this legislation that is so difficult to pass. Because, if it's, Connie or me, at least she's an attorney, I have a master's in public health, but for a lot of, people, decision makers, that's not enough. But it's someone with a medical degree that has, all this education and has the experience of seeing patients, like Dr. Cook was saying, that are coming to the ER because when PM 2.5 is too high, they have strokes, they have all kinds of things, not only, asthma attacks. So when you as physicians go and give testimony about this, is way more powerful than, and gives us a lot of ammunition as advocates, that if it's just us along, passing on what we read in a paper. So I encourage you, if you, I'm going to put my email on the chat. If you would like for us to have you added to our email list, sometimes it's just like, we need one phone call, we need one email, because the other thing is a lot of the legislators in our district, at least in the Central Valley, are super conservative. So we depend on people across the state to help us send that text, make that phone call, and make sure that your voices are heard by the representatives or the decision makers.
Yeah, absolutely. I mean, and I have this this horrible story where I was interacting with kind of a not a higher level, no in the public eye, a regulator, and discussing carbon capture technology and the fact that oil refineries are located really far away from these sites that carbon would supposedly be stored, right, in the valley. So you're looking at a CO2 pipeline that would go from the Bay Area to the valley. And I said, so what is the protocol, or what is your way of vetting the pipeline? And they said, well, we haven't gotten there yet. And I said, but the communities there, what happens if the CO2 pipeline explodes? And they said, I don't think CO2 is dangerous. But, doctors know that CO2 is an asphyxiant, right? And, I don't know if that's general medical knowledge, but, or at least having experiences and a scientific background and a medical background also gives you credibility, like using your credibility, I think, is exactly as Nayamin said, because I can say, but it's an asphyxiant. But it means so much more to regulators, and they take it so much more seriously if a doctor says it too.
I think what's important is the importance of teams, and teams work better when you have different diverse perspectives and, heuristics and points of view. And I'm a big believer in expertise and everyone working at the top of their certification. And for this to change, you need community activists, you need lawyers, you need physicians, you need politicians who understand politics, and you need regulators who understand policy. So you need everyone with all their expertise and their different perspectives to come together, because then the sum is bigger than the individual parts themselves.
Love that. A beautiful place to end the session. I want to give a deep gratitude to Connie, Naomi, and David, Dr. Cook, for sharing your expertise and time today. Thank you so much.